Good morning, everyone. My name is Joyce Tinaro, and I am presenting on the drug Mangafodipir. So, briefly, Mangafodipir is a contrast agent, and a contrast agent is defined as a substance which is used to enhance the radio density of a targeted tissue by altering the way in which electromagnetic radiation passes through. So the drug is present as Mangafodipir trisodium, which is marketed under the name Teslascan. So it is made up of two main components: the paramagnetic manganese 2 ions and the chelating agent for Fodipir. So the drug is also an organ-specific paramagnetic contrast media agent, and by this I mean that it targets specific organs. So this one targets the liver and the pancreas mainly. So the uses of the Mangafodipir include it is used in the imaging of the hepatobiliary system, which consists of the liver, the gallbladder, and the bile ducts, as well as in the detection of liver lesions or the pancreas, which are formed from metastatic diseases or the hepatocellular carcinomas. So in the next slides, I will be focusing more on the mechanism of action of the drug, its pharmacology, the routes of administration, as well as use in the radiology department. So, on mechanism of action of the drug. After the drug has been administered into the body, the chelate then starts to slowly dissociate to the manganese ions and the organic ligand Fodipir. And manganese is then taken up by the hepatocytes. The hepatocytes are liver cells with a high affinity for manganese, and they are very selective. So the ligand Fodipir is not taken up by the cells, but it is distributed to the extracellular fluid, and it is eliminated from the body later via urine. So the absorption of manganese into the tissues makes the normal tissue appear brighter in MRIs, and it is limited in cancerous tissue. So the normal liver tissue absorbs the manganese more than abnormal or the cancerous tissue. So this makes the normal tissue appear brighter in MRIs. So this enhanced contrast allows lesions to be easily identified. So the pharmacology of the drug. Like I said earlier, it is an organ-specific paramagnetic contrast agent, and it is used in patients who are undergoing MRI to detect lesions in the pancreas and the liver. So in the case of an overdose, there is no known antidote, and this drug, it also displays embryotic and fetotoxic potential, thus it is contraindicated in pregnant patients. So by this we mean that it could harm the fetus, so it is not used in patients who are pregnant. And then it is also not reported to be genotoxic, meaning that it does not have any known damaging effects to the DNA molecules in the body. So the normal effects of the drug include headache, nausea, feeling of warmth or of flushing. And then there are also some uncommon side effects, which include the hypersensitivity reactions, the vomiting, and palpitations, which are heart palpitations, and so many more. Routes of administration. So Mangafodipir is administered intravenously, that means into a vein, and it is under the supervision of a doctor. So the drug cannot be administered unless there is a supervision of a doctor. So the drug, its use in the radiology department. It is used as a diagnostic tool, and it is administered intravenously, like I said, to enhance contrast in magnetic resonance imaging. So this marks the end of my presentation. Thank you.